It is a tiny organ, about the size of a walnut. But when things go wrong with this organ, every trip to the bathroom will remind you who is truly in charge. Let's talk about the prostate gland, what it does, how you can keep it healthy, and features to look out for when things go wrong. Hi Prevention Circle, my name is Halima. I'm a medical doctor who's deeply passionate about preventive medicine. If you're new on my page, all I do is talk about preventive strategies to help us live a healthy and fruitful life. If this is something you would enjoy listening to, I would truly appreciate if you could follow, share, and subscribe to my channel. The prostate is a small gland that sits just beneath the bladder. It is wrapped around the urethra. You wonder what the urethra is. It's a tube that helps to take out urine from the body. The prostate gland helps to make a special fluid, and this fluid mixes with the sperm to give rise to a semen. Most men don't think about its importance, but it's a vital organ that helps with the male fertility. There are three main things that could happen to the prostate gland. First of all, you could develop prostatitis. This is inflammation of the prostate, whereby it could be due to infection, and the symptoms you experience is pain, burning sensation, or general discomfort around that place. The second thing that could happen to the prostate gland is enlargement, a non-cancerous enlargement, which we call the benign prostatic hypertrophy. And this impacts significantly on urination, and that's when you have the urinary symptoms. The third thing that could happen to the prostate gland is prostate cancer. This cancer is common in men, particularly age 50 and above, and if they are of black origin. Features to watch out for when there is a problem with the prostate. Number one, there could be a problem with the stream, the actual flow of the urine. In this situation, you realize that there is reduction in the stream. You could experience frequent urination at night, whereby you go to the toilet up to 10 times at night, although there are some disease conditions that could also result in this. There could be times whereby you feel the urge to urinate, but on getting there, you are not just able to urinate. And ultimately, there could be times whereby you cannot urinate at all. That's what we call the urinary retention. And this is an emergency that needs to be dealt with in the hospital. If you ever pass blood in your urine, this is not normal and needs medical attention. Do not let embarrassment delay care. Every man with a prostate gland is at risk of developing all of the above. However, early detection helps to save life. As a doctor who is deeply passionate about preventive medicine, this is where my role comes in. How do you create a healthy prostate? Number one, research has shown that exercise plays a significant role in prostate health. Brisk walk, engaging in physical activity has been shown to significantly help prostate health. Number two, healthy diet, eating lots of tomatoes, lots of fruits and vegetables, avoiding red meat as much as you can, and eating more of fish. 3, safe ejaculation. There are studies that have been carried out in various parts of the world that have shown that a decent amount of ejaculation could reduce the risk of developing prostate problems like cancer. However, this is not the time to engage in risky behavior by saying, I have to ejaculate 21 times, I have to ejaculate 30 times. No, a reasonable ejaculation. But this is not a guarantee. It is just a correlation. It doesn't mean if you go through all of this, you may not still develop prostate cancer. So sexual activity has a significant role to play in our lives. Cardiovascular health is one of it. So this is a form of exercise. So everything still boils down to exercise. Lastly, if you have a family history, even if you do not have a family history, as long as you're 45 as a black man, this is the time to start checking your numbers. There's something called the prostate-specific antigen. It is a tumor marker that helps to check if there's actually an enlargement of the prostate gland. So this is the time to book that appointment with your doctor. If you're 50 and above, you're Caucasian, this is the time to start checking your prostate, your PSA level. Prevention is not just about avoiding disease. It's about preserving the quality of life. We want to enjoy life.